Jack Maine is a 40-year-old Caucasian man who is struggling with alcohol consumption since the age of 6. As he has gotten older, the consumption has become worse. He now uses hard liquor. Well, he started using hard liquor at around 18 years old, and around 20 he started using cocaine. He mixes all of these opiates and drugs with alcohol. Jack was referred to us by Westside Hospital because he was found unconscious in the park. At the hospital, they took care of him and they referred us Blue Crest Recovery Center. Jack has never been treated for any disorder or spent any time in any recovery center. Jack has come to us on his own. He has stated that although he's not ready to stop his alcohol consumption, he knows that it's time to stop. Jack is married with no children. Both his parents are deceased, and he only has one older brother, Bobby, who has been taking care of him since the age of 12. Jack's father and Bobby's father passed away when Jack was 12 years old. Jack has severe alcohol use disorder. During the intake process, Jack has signed all required documents for admission and eligibility. The initial assessment has also been documented. The information for payment has also been taken in, and his primary counselor will be seeing him as soon as possible. During the orientation, Susan Mayer, who is Jack's primary counselor, will give him a walk through the premises along with Megan, who's another counselor. She is the one who usually does the walkthrough with the new patients along with their counselors. Jack is being informed of the rules, regulations, and what his rights are. Jack's short-term goals are to reduce his alcohol intake with a long-term goal of total abstinence from alcohol, from cocaine, and from opiates. Jack is being told what the hours of operation are, when they wake up, when they can go outside and do exercises, when the sessions will be taking place. He will be receiving a schedule so that he will be on time for everything. Him being on time and having everything that he's asked for by the counselors, if there's any homework, if there's any journals, if there's any writing that needs to be done, everything is being told at this moment so that it doesn't come as no surprise later on. He will be going into group sessions and individual sessions. During the assessment, Jack is asked about his history of drugs and alcohol abuse, and he describes how at the age of 6 years old, his father began drinking with him. Jack also tells us that his mother died while giving birth to him. She was very young, and his father was very old. Jack has also told us that he tried committing suicide when he was a teenager, and that it failed. He told us this while laughing, while he was laughing, what he was saying, and he said that he was glad that nothing came of it. Jack has never had any legal problems. He reports to drinking and taking opiates before he goes on stage because he feels anxiety before he goes on stage. So in order to reduce it, he says that he takes about 6 pills with some gin. We will focus on his triggers and on how alcohol became his scapegoat to not have to deal with the reality that is around him. Jack has agreed to enter the program and have individual and group sessions with one or two or more counselors. Jack's long-term goals, as we have stated before, are to have complete abstinence from all drug consumption, opiates, or alcohol. His short-term goals are to go to counseling, to be on time, to slow down the consumption of alcohol, opiates, and cocaine. And he will receive 3 individual sessions and 3 group sessions a week. And he will also be attending AA meetings a week, three AA meetings a week. During the 3 sessions of the individual counseling, Jack has expressed how his father would abuse him mentally and emotionally. It has been difficult for Jack to come to terms with his abuse, but he sees that drinking would always ease the tension or ease him, ease his anxiety and whatever was that the turmoils that would come within him. Jack is doing well in the AA meetings. He's talking, he's listening, he's sharing. He's learning to cope with his troubles with his alcohol consumption. He sees why he started taking cocaine and why he started abusing opiates. Jack has not had any crisis during his stay with us. Everything has been running smooth. He had a little bit of a difficult time slowing down the intake of the drugs, but he's doing well now. Jack has been in the program for 3 months now, and he will add to his schedule a didactic counseling. First on alcohol, then on opiates, and then on cocaine. We want him to be aware of what these drug consumption is doing to his body, to him mentally, to his family, to his friends, just all in all to everything that is surrounding him. Jack has an understanding of what his consumption is doing and how it is affecting him. Jack is approaching the end of his stay, and everything has been documented to help him move on to the next step. His long and short-term goals have been satisfied, and Jack wants to continue to see a counselor at least twice a week. And he has also told us that he will keep going to the AA meetings at least twice or 3 times a week, just because he wants to share his story. He wants to be able to do for someone else what was done for him. He told us that listening to how people cope with the struggles and how they were able to manage their urges, just being able to listen to all of that actually helped them a lot in being able to deal with his own troubles. So this is what he's going to be doing. So we had a good outcome with Jack. Thank you, Professor.